Hi, my name is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today, I'd like to present an interview with a patient we've been working with for the past few weeks. The patient came to see us with a medical diagnosis of cystic fibrosis, a condition which affects her sinuses, her digestive tract, and her ability to become pregnant. After a few short weeks of working with us, the patient experienced significant improvements in her symptoms, and we're happy to announce that she has become pregnant after having tried unsuccessfully for the past 3 years. The following interview is a detailed account of the patient's own experience with us at the clinic and the significant improvements that she has seen while under our care.
Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today with Denise Cruz of Alpharetta, Georgia. And Denise came in, what was it, about 6 weeks ago originally?
Yes.
We gave you a report of findings about 2 weeks ago. And tell us a little bit, Denise, about what brought you to the Goldberg Clinic originally.
Okay. I have the genetic disease of cystic fibrosis. I'm now 37. With cystic fibrosis, I'm used to a lot of congestion in my sinuses and a chronic cough due to the extensive mucus that my body produces. And that mucus clogs up other bodily functions as well, such as it could be digestion, it could start affecting all kinds of things in the system. And
in your particular case, what kind of symptoms did you normally experience that were troublesome for you?
Well, normally, and I got very used to having post-nasal drip, even with medications that my other doctors had prescribed to me. Specifically, I would wake up each morning and have to gargle to get the dried mucus out of my throat. That was just normal behavior for me, and I thought it was just due to my cystic fibrosis diagnosis.
And when you came in, we did some testing on you, and then we set you on a program that started about 2 weeks ago, which you have been following.
Yes.
And what has changed over those past 2 weeks?
To my surprise, the first thing that I noticed is that my sinuses cleared up. I cannot believe it. I don't have any more post-nasal drip, and I feel as clear as I did probably 15, 18 years ago before I started getting my chronic sinus issues. The second side effect from this protocol is that I did realize I've become pregnant in this.
And how many years were you trying to get pregnant before this?
I was trying to get pregnant for 3 years before this, and the doctors couldn't give me a definitive reason why I was not getting pregnant. They thought that perhaps my body, with cystic fibrosis, produced more cervical mucus, which prevented the sperm from meeting the egg. And within 2 weeks of eating differently, I'm pregnant.
Yes. So we had the clearing up of the discharge from your sinuses.
Yes.
Generally feeling somewhat better, and after 3 years of trying to get pregnant, you suddenly got pregnant.
Yes.
And I would garner to say, I would think that probably there may have been something to do with the mucoid discharge down there, that just as your sinuses have cleared up, it is also cleared up down there in your female organs, and perhaps that is what has allowed you now to get pregnant.
Yes.
One other thing, Denise, you had been, despite the fact you had your sinusitis, you were unable to get pregnant, you were under medical care, you were under the care of cystic fibrosis experts, correct? Including a dietitian.
Yes.
Including a dietitian.
Yes.
Okay.
Yes.
Well, we wish you the very best. We're looking forward to having a very good future with a now hopefully enhanced and enlarged family.
Thank you.
Okay. Thank you, Denise.
Thanks.